Good evening, welcome. I'm Heather Dizelle with JoyLux, where I have had the pleasure of getting to know and work with Dr. Boxer. As our professional partners were forced to close a few months ago due to COVID and the use of telemedicine immediately skyrocketed, we thought it would be helpful to hear really from one of the foremost experts in this. We're honored to have Dr. Boxer with us tonight to share his knowledge on the really complex and growing industry of telehealth. Dr. Boxer graduated from the University of Wisconsin undergraduate and medical schools and completed his training at UCLA in urology. Dr. Boxer has a teleurology clinic that consults with patients around California. He has been a health policy advisor to the White House. He's represented the US at the World Health Organization. He's been a finalist for Surgeon General of the US, not once, but twice under both President Clinton and Bush. And he was the prior chief medical officer at Teladoc, where he really wrote the first medical guidelines for evidence-based telemedicine. So prepare for some amazing education from a wonderful and extremely talented person. Thanks for being here, Dr. Boxer. We appreciate it.
Well, thank you very much. I appreciate the opportunity, and getting to know those, the friendly people at JoyLux has always been a pleasure. And good evening to, and good afternoon to all of you who have joined us. And so today I'm going to be talking about the opportunities within telemedicine for all aspects of healthcare. And at the end, there'll be opportunities, and actually I think throughout the program, there'll be opportunities for you to send in chat questions. But I hope to be able to answer your questions towards the end of this discussion. So the agenda tonight is basically to talk about what telemedicine is, why telemedicine, the business side, home health care, the regulations, the drivers, opportunities, and like I said, towards the end, the questions and answers. So what is telemedicine? Now, this is a very broad term of telehealth, which has no restrictions on who performs it and what the modality is used, and restricted from the practice of actual medicine. But telemedicine is actually the practice of medicine, diagnosis and or treatment, with a format that varies from state to state. Most consider this video-based, and most states actually require video to be paid. But as an example, the world's largest telemedicine company, Teladoc, only, or not exclusively, but principally uses the telephone, and quite frankly, that is what has been going on in a significant number as we've entered the COVID period. So telemedicine, excuse me, increases the access to care. Everything I've done in my career as it applies to improving healthcare for large populations is to increase the access to care. And fundamentally, telemedicine is convenient access to quality care. It maintains some income for an office during periods of time when it's closed, but truthfully, there's a large population of doctors who were using it before COVID, and now it's just spectacularly large. It generates referrals, which is a big aspect of telemedicine. That is, if you contact and communicate with your patients, even if they're not even your patients, so to speak, but people who are interested in your services, they will naturally come to you when they have an issue that is a bother to them. And of course, during the COVID period, it eliminates exposure to caregivers or family members if you have a communication via telemedicine. In our on-demand society, we have a population, our entire country really, but certainly a large population, where technology has shifted the paradigm. And the fundamental issue and the fundamental paradigm shift is that we need to bring medicine to the patient, not the patient to medicine. Our system is, and frankly around the world, but particularly our system is just too expensive, too cumbersome to bring people to a bricks and mortar. And that's why we're bringing healthcare to the patient. There is no scenario in the future of healthcare delivery that does not include connected health, which is an even broader term for telehealth or telemedicine. So healthcare without walls. Uber is the largest taxi service that owns no vehicles. Facebook is the world's largest media owner, creates no content. Airbnb, the world's largest accommodation provider, owns no real estate. And so the largest provider of care will own no hospital or clinic. New York Presbyterian has 1.6 million outpatient visits per year. All of telemedicine before COVID was 5 million a year, and now it's close to 200 million a year. And the Kaiser Permanente CEO has said that virtual visits will outnumber in-person visits without losing the personal touch. I agree with him. During the COVID, nearly 3/4 of the population would consider using telehealth to remotely be screened for COVID-19. 2/3 said that the pandemic has increased their willingness to try virtual care. And 60% indicated that COVID-19 has made them much more likely to consider telehealth. So connected health is quite large. It's a regulatory nightmare in some respects, but certainly it's an efficiency dream. As we all know, regulatory agencies are only too happy to regulate everything in sight, and yet the walls come tumbling down. There's remote second opinions. There's direct to consumer. There's business to business, home health monitoring, which we'll talk about, which is going to really explode, and the CARES Act, which passed just in the last few months, has allowed cross-state licensing. So there are 29 states that allow a person to sit in one office and talk to a person in another state. Usually, or in pre-COVID, you had to be licensed in the state where the patient was located. Now, you only need to be licensed in your state as long as your state and the other state have a relationship so that you can have cross-state licensing. In connected health, the technology barriers have reduced. The technology has become so easy that the barriers are reduced tremendously to the entry within connected health. Remote care with monitoring and cable box. This is what's really going to be important, because there are literally hundreds of thousands of monitor equipment that can be placed on a person or in a house, and you can monitor your patient or determine whether or not a particular device, such as the VFit or whatever, but you can communicate with your patient and determine how the patient is doing without that patient being in your presence. There are 2,300 rural hospitals without specialists, and 10% of physicians live in areas where 25% of the population live. So what it means is that there is an enormous number of people who require access to care. In fact, there's 100 million Americans live in areas that do not have easy access to care. So with specialty care through telemedicine, such as stroke or dermatology, people are able to have in a small community hospital a world-class specialist to be able to help them. Of course, with smartphone apps such as FaceTime or Skype or any of the others that are now being used, such as Zoom right now, you can be in your home, as I am now, connected to doctors all around the country or patients all around the country and help them where otherwise they would not have access. The telehealth market was predicted to be skyrocketing, hundreds of thousands of people, millions actually, but right after the COVID crisis, the number of visits have increased from perhaps the expected 36 million to 200 million. And so you can see that the sky is the limit, and you should definitely be part of that. Another part of the reduced barriers, went wrong direction. The future of medicine, as was predicted by Eric Topol, who is a doctor at Scripps and also he and others consider him a futurist, predicted back in 2017 that there would be far more televisits than physical visits. And certainly, although he wasn't expecting the COVID, he certainly turned out to be right. The goals of telemedicine programs for those people who are presently using it is to improve access to care, have more efficiencies in delivery of care, better care coordination, better management and post-discharge and readmission. Now, as an example of the post-discharge readmission, there was a study of about 3,000 patients out of the University of Miami where they looked at congestive heart failure patients. Congestive heart failure is the most common diagnosis for readmission into U.S. hospitals. And by connecting them with in-home monitoring, such as pulse oximetry, a scale, it's very, very simple things, blood pressure monitoring, they reduce the readmission by approximately 44%, which is spectacular for the improvement of health and the reduction of costs. The leading services by current users, as I started to mention earlier, was presently urgent care, primary care, talk therapy, psychiatry, readmission, as I mentioned a moment ago, and chronic care management. And so each of these are going to increase now that COVID has settled in, and hopefully we'll have a vaccine or some kind of medication like Tamiflu, but for COVID. But right now, it's a process and a technology that is critical and will be critical into the future. So the future users, again, chronic care conditions, but orthopedics such as movement disorders, or for neurology, but orthopedics as far as ability to have various range of motion, and cardiology for, of course, cardiovascular disease, and again, readmission prevention, cancer, and psychiatry. The demand and supply of physicians has been something that people have talked about for a while. That is, with the large population that is growing all the time, whether it's through births or through immigration, the population of the United States has been growing, and there hasn't been a commensurate increase in number of doctors. And so there has been predicted to have a margin of several 100,000 doctors who are needed but will not be there. Well, if the doctors receive a smartphone and connected through telehealth, they immediately are able to interact with their patients and deliver care. So for doctors who are stay-at-home moms or dads, doctors who are early retirees, these doctors are being taken out of service, so to speak. And when you talk about doctors, you're really talking about time slots. Each doctor has about 5,000 time slots a year. And if you lose 10,000 or 20,000 doctors due to various illnesses, disability, or just simply burnout, you can see how rapidly the numbers of slots would disappear. Well, if you give the doctor, a smartphone and connect them into a health system that has connected health or telemedicine, you suddenly put all these people back online, as it were. And it's a method by which they can also fulfill their satisfaction of practicing medicine, and maybe their spouse will get them out of the house, who knows. But in any case, there'll be a great improvement in access to care. So when do you utilize telemedicine? Well, if you need a specialist and the doctor is not in the same community or available, when the patients are immobile, when it's difficult in the office setting for the patient, with integrated care or chronic care management, care in schools, for example, you don't need to have you can have access to the school nurse if there is one, so that the child will be able to get good care immediately. Rural communities, as I mentioned, and of course COVID-19. The satisfaction rates are enormous. There are people who are 77% of all respondents were satisfied with the care they received. And again, that's before COVID. And so people are eager to have telemedicine because of the convenience and the quality. And I mention quality because if there's never a situation, whether it's university or private practice, where someone actually goes into your practice and determines whether or not you are giving quality care. Whereas in telemedicine, the medical records can be reviewed by you or your colleagues, whatever, and there can be quality assurance given to you as not in any critical way, but a method by which you can improve the care of telemedicine for your patients, and it is in a method by which it actually gives you quality assurance. The drivers and opportunities before COVID, well, there were 400,000 consults a month approximately before COVID, maybe a little bit more, but that only represents about 2% because there's over 1 billion consultations done a year in the United States, 80 million a month. And so it is easily said that at least 25% of all medical consultations can be handled either through video or through a telephone that is telemedicine. And that means that when I said before, the sky's the limit, it's just remarkable how people talk about telemedicine as if it's a mature industry. And it has since I helped start it about 16 years ago. But it is still at the floor. Institutions, hospital systems, they're all getting into it for lots of good reasons. And so the floor and the floor is about 20 million visits a month. And so that's why I say that it's really absolutely on the floor before we are able to say that it's completely mature. 20% of Americans still live in areas where shortages of physicians and healthcare specialists exist. The timeliness, you can telemedicine companies or hospital institutions and systems will say that they'll have a board certified doctor speak to you within 20 minutes, sometimes even much less. And so timeliness is really important. And the reduced cost is pretty remarkable. $100 to go to an office visit, $1,600 for emergency room visit, $45 for a virtual visit. You can see why payers are very excited about having this happen on a larger scale. Of course, convenience, the quality of assurance that I mentioned, and improved doctor-to-doctor communication, because there's lots of ways where you as a physician can interact with your colleagues and help your patients very quickly. The only concern has been whether or not there are certain telemedicine communications are HIPAA compliant. These are being overcome, and but privacy is always an issue no matter what we do within healthcare. The employers are very interested in having this done. The cost of absenteeism is $226 billion a year, because if a patient is not feeling well, they won't show up for work. There's also presenteeism. If a person is not feeling well, they will not be productive. Whereas if they are able to call a doctor and, let's say on their coffee break, get a Bactrim for a UTI or something, their problem is solved immediately, and they're a much happier and healthier workforce. So containing costs, 51% of large employers have identified that this is the way to go. And actually 26% of large employers are incentivizing the utilization of telemedicine. Well, Medicare and Medicaid are finally getting into the picture. But before COVID, 0.003% of Medicare was being spent on telemedicine, whereas that's out of $588 billion. So it's been very, very small. However, with the CARES Act and very rapid improvement in the finances of telemedicine, Medicare is getting into the picture, and it will be paying, it already is paying for telehealth visits. So in order to really have a good telemedicine experience, you need a HIPAA compliant platform. Physician needs a webcam and a microphone, no big deal. Patient needs a computer and a webcam and a microphone, that's a little bit bigger deal, or a smartphone. And everyone needs good connectivity. So all those things are being conquered, but there are some issues, particularly in rural America, where there isn't quite as good connectivity as within urban America. So you can see that that early adopters within your population would be young, urban, higher income, and privately insured. But even without those four, you can see, and we've talked about, that the younger, wealthier, urban population, although it isn't, it's about 2/3 2/3 of America lives in urban areas, but the younger and higher income are people that are extremely interested because they have a little bit more money than time. They just don't want to come into the office. And so telemedicine is exactly what they want. The barriers to adoption, well, as this picture of Jericho, the walls come tumbling down. Lack of reimbursement has been stated to be one of the biggest concerns of physicians, but with parity laws around the country, within states around the country, these lack of reimbursements have been eliminated or markedly reduced. There's restrictive regulations which are also markedly reduced because states have recognized not only that it is saving money, but it's increasing access to quality care. The cost of technology is almost zero now. And the loss of revenue, well, that's been significant, of course, during COVID, where we're all small business people for the most part, and the loss of revenue has been a serious problem during COVID. But this really improves the revenue, not only today but into the future. Hospital telemedicine is, I think, pretty interesting because there's a dearth of specialists in rural areas, and so this is a picture of basically an iPad on wheels. But this is at UCLA, where we certainly have enough specialists. But you can see that you can have intensivists go from bed to bed in an ICU, and this is obviously really important in the COVID or any infection, epidemic or pandemic, where you can get a specialist sitting anywhere in the country, for that matter, with cross-state licensing, but certainly anywhere in the state where the patient is located. And the robots can go in and interview the patient. The information can be uploaded. The doctor can review let's say if it's a stroke or neurologic problem or psychiatric problem, or intensivist like this picture is, the doctor can review the information and the patient can be treated as if the doctor is right there. The regulations have been a problem, but they're also, the walls coming down. Doctors are regulated on a state level, and states don't want to give that up. Yet, with the CARES Act that was just a couple months ago passed, there's 29 states have now cross-state licensing, and that is likely not to reverse because people are getting used to it, and it's very difficult to take something like this away because doctors are available around the country, around different time zones, whatever, and doctors are willing and able to do the best for their patient. The future of telehealth, well, the truth is that telemedicine is telephonic. That's, it's the first telephone was used to call for a house call, basically. Now we have, of course, a smartphone, and we're going to have virtual healthcare out of your computer. The future is extraordinary, and that is because the only thing we have to not even worry about, we have to know that our imagination is the only thing that's going to reduce the chances for greater care. So it's very, very exciting. The drivers and trends, well, Obamacare increased the demand, and the shortage we talked about 50,000 primary care physicians, but once everyone's connected, it's going to be reduced markedly. Those numbers are old numbers, and we'll be able to take care of patients anywhere in the country. Aging and increased chronic disease, that'll be part of the chronic care of monitoring that we'll be able to do when patients are in their home and we're in our office, or we're not in the office, we're someplace else. As far as malpractice litigation and defensive medicine, there has never been a successful lawsuit for it within telemedicine. And that's principally because telemedicine has always been, cough, sneezes, upper respiratory infections, urinary tract infections. There hasn't been much loss, so lawyers can't sue. But as we get into more advanced chronic care management, there may be problems, but these will also be overcome by just being smart about it. With the aging in place and on-demand services, genomic medicine, obesity, addiction, immigration, physician workforce, concierge medicine, accountable care organizations, whenever there's anything at risk, there is always going to be people that will be trying to determine if there's a way of either A, having an opportunity, or B, being an obstacle. I've always been an optimist, and I'm an opportunity seeker. So these are all opportunities for telemedicine. One of the mega trends, regardless of policy or politics, is aging. Our population is aging. And so the older the patient gets, of course, the more comorbidities there are. That is why chronic care management will almost certainly be done by health systems or the doctor who's been caring for the patient all along, as opposed to one-off, let's say MD Live or Doctor in Demand or Teledoc. It'll be more likely that health systems and the doctor who has been caring for the patient all along will take care of the older, more chronic kind of situation for healthcare. That's the way it should be. The patient, if a patient is 29 years old and has discomfort with urination, dysuria, so it's going to be a urinary tract infection almost certainly. But if an older woman has that, it could be a lot of different potential illnesses. Or a cough could be just an upper respiratory infection in a 29-year-old, but it could be a lung cancer in an 82-year-old. So you really need to have a much greater amount of information for the aging in place patient as opposed to the younger patient. Now, the Holy Grail has been direct to consumer. And that's been a problem because regulatory agencies are very leery of patients simply looking online, calling a doctor, and trying to get a prescription. So prescriptive control is very important, particularly in the situation where we have abuse of medication. Well, no telemedicine company or health system allows opioids to be prescribed over, for telemedicine. It just, number one, shouldn't happen. Number two, doesn't happen. Or if it does, the person who does it can go down, to jail for doing that. So it's just never done. But, the Holy Grail in Indiana Jones or for Dan Brown was two completely different things. But within telemedicine, it is direct to consumer, and perhaps it'll happen. But right now, because of the massive increase in telemedicine within doctors' offices or health systems, that it really won't be a problem, I think. The next big thing is chronic care, and that is with the 325,000 medical applications now available, you can see that people can be monitored anywhere. You can have a tattoo of sorts on your wrist, and it can predict depression by virtue of the sodium or the potassium or the sweat or the pulse rate, the blood pressure. It's really remarkable what the applications can do. And so what's going to happen is that the doctors will be, or their nurses will be calling a patient and saying, I think you're getting sick. Instead of 5 days later, a patient calling the doctor and say, I am sick. You can see that it will be pretty remarkable. And, show me the money, or that's where the money is. It's all chronic care. billions and billions, hundreds of billions of dollars will be saved, but more important, quality care and people will be saved by telemedicine in the chronic care situation. So home care options, whenever it's possible, you allow your patient to be proactive at home so that they can interact with you or a nurse specialist, home care specialist. From physical therapy to urinary incontinence, quite frankly, I deal with that every day in my telemedicine practice. And as a urologist, I'm talking to patients all over the state of California because that's where we have a system. But patients are enormously pleased with the results of the interaction of a specialist being able to go directly to them and help their situation. You know, as a shameless plug for VFit, the patients will, I find that patients do have pelvic health problems as you do every day. And this is a product, but more importantly, it is it's something that we can discuss and you can discuss, particularly with Dr. Sarah Delatorre, who is available for interaction. She's an OBGYN that is using these products every day and is found to be quite, more importantly, our patients are found to be quite remarkably good.
Thanks for joining us. Thank you again, Dr. Boxer. And
well, it's a pleasure. Thank you for asking me to do this. It's a pleasure working with you.
You as well.
And everyone have a good evening. Stay healthy and stay safe.